Hello everyone, this is the review session for the midterm exam. But before I get into the review checklist, I'd like to make an important announcement. And that is this coming Monday, February the 27th, we will have a guest speaker who will be the South Georgia Medical Center CEO. He is a graduate of the University of Alabama at Birmingham, the number two ranked school in health administration, which is also where your professor graduated from. But Dr. Ray Sneed, who I know personally, um, was named as Becker Health Review's top 150 CFOs to know. He's a national known entity in the healthcare industry, and you do not want to miss him. His talk will be mainly about leadership, what got him to his position, and he will be taking questions from the audience. If you have not already posted a question, I encourage you to do so and also to come for the event if you live close by. Those in my face-to-face class, HCAT 3200A, um, I will be strictly enforcing the attendance policy, so if you cannot make class for whatever reason, I will need to see evidence. If not, I'm afraid there will be a penalty. And of course, if you do attend, um, there will be bonus points awarded. For those in my online class, I understand that some of you live far away, so do your best to make it if you are not too far away. Again, bonus points will be awarded, but no penalties in your case for those who in my online class. Okay, let's get to the review session. Um, on Monday, those in my face-to-face class as well as my online class will be able to pick a copy of this up at the SGMC CEO's talk. I will leave these copies of the review checklist in front of the auditorium, the classroom, along with the sign-in sheet. So be sure to sign your name in so that your attendance can be recorded and that you will be awarded the appropriate bonus points. Also, be sure to pick a copy of the review checklist when you sign in. Um, I mentioned in last class period, that the review checklist is all you need for the midterm as well as the final. Uh, by this, I mean that I have narrowed down all the main points that you need to know, and by watching this review session, you should be able to score an A in the midterm as well as the final. Why do I say this? Number one, I'm here to educate. I'm not here to punish you. I'm not here to take away your points for whatever reason. I'm here to help you to learn, to encourage you to learn. And by this, I want to narrow down, I want you to save your time focusing on the important main points. Um, when you print out or take a copy of the review checklist, it will be like this. As I go through the points, the chapters and each of the main points in the on the list, if I were you, I would be writing down the keywords or what I believe are the keywords. I'll be giving you keywords for those that lend towards easy keywords, but if not, summarize whatever I say to the best of your ability, write it next to the topic. Okay? Like this. This is an example. When it comes time to take the midterm or the final, the questions will be randomized. So say the first question is matches what chapter 1.1 is. Okay, I'm going to look through my list for the notes as well as what question one relates to, and I see that, oh, it relates to group insurance. And my notes say that the keywords there I've written private insurance risk spread among paying individuals. With those keywords, I should be more than able to answer the midterm question. Same goes for your final. So once I've answered that question, what I'll do is I'll cross it out. You can use a highlighter, do whatever you need to mark it so that you know that that bullet point has been taken and it's no longer applicable to any other midterm question. That way, as you work through the midterm questions, there'll be fewer and fewer bullet points on your review checklist. That way, you will save a lot of time going down, up and down your review checklist looking for the related point. Okay? If you have any questions, be sure to post them in Blaze View. Start a new forum post if none has been started on the midterm, and be sure to post your journal questions there. So with that, let's begin. As I am going through the review checklist, I expect that you will have it in front of you and would be able to take notes. Um, when you watch this video, you might not have access to it, but come to class for those in my face-to-face um, class and those in my online class, you should be able to have access to it sometime before the midterm. Okay, bullet point number one. Chapter one, bullet point number one is related to group insurance. Um, the relevant textbook section is page 10 on the middle of the left column. Oh, one other thing, if you do not have your textbook, going through this review session, attending this review session, taking appropriate notes on the review checklist, that should be more than sufficient for you to ace the midterm as well as the final. I understand that some of you share textbooks and as such, it's difficult to share a textbook during an exam. That is the whole purpose I have taken so much effort to create this review checklist as well as record this session for you. Okay, so going back, chapter one, bullet point number one relates to group insurance. Um, Group insurance is a type of private insurance where a large group of individuals will purchase insurance through their employer and the risk is spread among those paying individuals. The key words there are private insurance and risk sharing. Okay. Second bullet point, chapter one, bullet point number two, voluntary health insurance. Voluntary health insurance is a type of private health insurance that is provided by not-for-profit and for-profit health plans such as Blue Cross and Blue Shield. Know that this statement is true. Know that this statement is true. Okay? Moving on. Chapter 1, bullet point 3, the Healthy People 2000 report. Healthy People 2000 report in 1987 was created to implement a new national prevention strategy with three major goals. And what are these goals? They are to increase life expectancy, increase access to preventive services, and reduce health disparities. So the keywords there are increase life expectancy, increase access to preventive services, and reduce health disparities. Okay, chapter 1, bullet point number 4, American Recovery and Reinvestment Act of 2009. Obama signed the American Recovery and Reinvestment Act to protect health coverage for the unemployed by providing a 65% subsidy for COBRA so that premiums would be more affordable. Keyword there, COBRA, C-O-B-R-A. One simple keyword. Okay. Medicare and Medicaid. Bullet point number 5 on chapter 1. In 1965, Medicare and Medicaid were established as federally funded programs to provide health care access to the elderly and the poor respectively. You need to remember that care is for the elderly and poor is Medicaid. You care for the elderly, you aid the poor. That's how you remember it. Medicare is for those who are old, and Medicaid is those who are poor. Okay, chapter 1, bullet point number 6, EMTALA. Know that EMTALA, the Emergency Medical Treatment and Active Labor Act, was passed to ensure that consumers were not refused treatment for an emergency life-threatening health situation. Keywords there are emergency life-threatening health situation. Okay, bullet point number 7, the last one under chapter 1, the Medicare Prescription Drug Improvement and Modernization Act. Know that the Act created Medicare Part D. D for Denmark. D for drug. Okay? Medicare Part D is the prescription drug program. Keyword there is Part D. D for Denmark. Okay, chapter 2, bullet point number 1, essential health benefits. Okay, know that essential health benefits refer to maternity and newborn care, prescription drugs, and emergency services. These are the keywords. Maternity and newborn care, prescription drugs, and emergency services. Okay, summary of benefits coverage, bullet point number 2. The purpose of summary of benefits coverage is to enable consumers to compare different health insurance plans. Enable consumers to compare different health insurance plans. Okay, moving on, the Physician Compare website. The purpose of the Physician Compare website is that it allows consumers to find out which physicians accept Medicare. That's the purpose. Allows consumers to find out which physicians accept Medicare. Medicare, not Medicaid, okay? Okay, why did the states sue the federal government over the Affordable Care Act? That's bullet point number 4 in the chapter 2. The states sued the federal government because They question the constitutionality of requiring individuals to purchase health insurance. That's basically the mandate, the individual mandate. And they also question the mandate of the states being required to expand Medicaid coverage. Unfortunately, this does not lend to short keywords, so go back and review this section of the video if you need to. Okay, moving on, chapter 3, bullet point number 1, duty to treat. In the US healthcare system, there is a concept called duty to treat, which means that any person deserves basic healthcare. Know that this is a true statement. Know that this is a true statement. Okay. Chapter 3, number 2, bad debt and charitable care. Bad debt and charitable care means that the provider either does not expect payment patient's after the patient's inability to pay has been determined or efforts to secure payment have failed. Know that this is a true statement. Okay? Know that this is a true statement. Okay, healthcare access. We're skipping um, 2 bullet points. So it's chapter 3, number 5, healthcare access. Know that healthcare access should increase, go up, as a result of the Affordable Care Act. Also know that health insurance is a major reason for healthcare access, and healthcare access varies across the country. So 3 keywords: increase, health insurance, and it varies. Increase, health insurance, varies. V-A-R-I-E-S. Okay. Bullet point number 6 under chapter 3, American Healthcare Association. This professional organization represents nursing, assisted living, developmentally disabled, and subacute providers. So 4 keywords: nursing, assisted living, developmentally disabled, subacute providers. That is the professional organization that represents these providers, healthcare providers, American Healthcare Association. Okay. Bullet point number 7, healthcare employment under chapter 3. Healthcare employment can be found all over the country, but it can be more easily found in large states such as New York, Florida, where there's a large population of elderly people who require more healthcare than the regular population, Pennsylvania, Texas, and California. So five keywords: New York, Florida, Pennsylvania, Texas, California. These are large states. Okay. Okay, let's go back to chapter 3, number 4, bullet point number 4, the lower US medical graduation school rate. Why does the US have a lower medical graduation school rate than other countries? It's because the curriculum is difficult and the cost is expensive. 2 keywords: difficult, expensive. Okay, Bullet point number 3, the US hospital beds rate. Why is it low in America? And the reason is because healthcare consumers prefer outpatient services. Outpatient services is the keyword. Okay, so we're moving on to chapter 4, the government's role in US healthcare. And first bullet point has got to do with the Office of the Surgeon General. Office of the Surgeon General oversees the operations of the Commission U.S. Public Health Service Commission Corps, who provide support to the Surgeon General. This is a true statement. Okay, know that this is a true statement. Bullet point number 5. The Council of State and Territorial Epidemiologists. The Council of State and Territorial Epidemiologists decide which diseases should be considered reportable to the Centers for Disease Control, also known as the CDC, and produce in a weekly report called Morbidity and Mortality Weekly Report, MMWR, which publishes the prevalence of disease throughout the country on a weekly basis. It's too long for any keyword, so know that this statement is a true statement. Okay, the National Incident Management System. That's bullet point number 6 under chapter 4. Okay, the National Incident Management System provides a systematic, proactive approach to all levels of government and the private sector agencies to collaborate to ensure that there's a seamless plan to manage any major incidents. Again, know that this statement is a true statement. Okay, going back to bullet point number 2 on the previous page. Chapter 4, bullet point number 2, local health departments. Local health departments are the governmental organization that provides most direct services to the population. Know that this statement is a true statement. Okay, Health Resource and Services Administration, bullet point number 3 under chapter 4. The Health Resource and Services Administration provides access to essential healthcare services for people who are low income, uninsured, or who live in rural areas or urban neighborhoods where healthcare is scarce. Is this true or false? It's true. Okay. The FDA, the Food and Drug Administration, that's bullet point number 4. The FDA is responsible for advancing the public health by helping to speed innovations that make medicines and foods more effective, safer, and affordable. Know that this statement is a true statement. Okay. Jumping to bullet point number 7 under chapter 4, the next page. Office of the Assistant Secretary for Preparedness and Response. This office provides grants to strengthen the capabilities of hospitals and healthcare systems, builds federal emergency operations capabilities, and focuses on preparedness and response. 4 keywords: preparedness, response, capabilities, grants, grants. Okay, that concludes chapter 4. We are moving on to chapter 5. Chapter 5 is public health's role in healthcare. And we are going to skip to the sixth bullet point, the epidemiological triangle. That's bullet point number 6 under chapter 5, epidemiological triangle. What are the three components of the triangle? They are environment, host, and agent. Environment, host, and agent. Those are your three keywords. Okay. Tertiary prevention. That's bullet point number 2. One example of tertiary prevention is rehab of stroke patients. Rehab of stroke patients. One keyword, rehab. Rehab refers to rehabilitation. Okay. 10 essential public health services. That's bullet point number 1. One of, okay, 10 essential. Among the 10 are mobilizing community partnerships to identify and solve health problems. That's 1. Monitoring health to identify community problems. That's 2. 3. Diagnose and investigate health problems in the community. 4 keywords: mobilize, monitoring, diagnose, and investigate. Mobilize, monitoring, diagnose, investigate. Okay, social media, bullet point number 3. What role does social media play in the healthcare industry? It has become a tool for healthcare education, communication tool for patients, communication tool for providers. 3 keywords: education, patients, providers. Okay? The American Cancer Society, American Health Association, American Lung Association. What do they have in common? They have active health promotion activities at the national, state, and local levels. Okay? 2 keywords: health promotion. So that was for bullet point number 5 under chapter 5. And we are going to bullet point number 4 under chapter 5, primary prevention activities. Primary prevention activities primarily focus on reducing disease development. 3 keywords: reducing disease development. That is what primary prevention activities does. Okay, that's chapter 5. We are going to move on to chapter 6, inpatient and outpatient services. Okay, going to skip to bullet point number 8. So chapter 6, bullet point number 8, employee assistance programs. Employee assistance programs. Employee assistance programs are a type of occupational health programs. They were established in the 70s for employee drug and alcohol abuse, expanded to offer other services such as tobacco cessation, mental health counseling, and referrals. This is a true statement. Um, so if I were you, I'm not going to summarize that whole long statement. Just put the word true next to employee assistance programs. I hope this is helpful. Okay. Um, Bullet point number 9, chapter 6, bullet point number 9, short stay or acute care hospitals. A short stay or acute care hospital focuses on patients who stay on an average of less than 30 days. So this is a true statement, right? Okay. Hospital certification, chapter 6, bullet point number 6. Why is it important? Because certification enables hospitals to obtain Medicare and Medicaid reimbursement. Three keywords: Medicare, Medicaid, reimbursement. Urgent emergent care centers. That is bullet point number 7. They were established in the 70s because they provided an opportunity for healthcare consumers who need medical care, but the situation was not life-threatening. Three keywords: not life-threatening. Not life-threatening. Okay. Self-Determination Act of 1990. That's bullet point number 5. The purpose of the act was to require hospitals that treat Medicare and Medicaid patients to provide information to the patients about their rights when they are admitted. One keyword: rights. R-I-G-H-T-S. So that's R-I-G-H-T-S, and that's a keyword for the Self-Determination Act of 1990. That's bullet point number 5 under chapter 6. Cost containment approaches. That's bullet point number 4. An example of cost containment approaches: Lean, L-E-A-N, Six Sigma, and Plan, Do, Study, Act. All these are examples of cost containment. Again, Lean, L-E-A-N, lean not fat. Six Sigma, 6 as in 1, 2, 3, 4, 5, 6. Sigma, S-I-G-M-A. And Plan, Do, Study, Act. Those are your keywords, okay? All these are examples of cost containment. Okay, hospital emergency services. Which population is more likely to use hospital emergency rooms for their healthcare? We know it's the poor, the elderly, and those who are on Medicaid. So the indigent, who are also known as the poor, indigent, I-N-D-I-G-E-N-T, the elderly, and those on Medicaid. Medicaid, not Medicare. Okay. That was for hospital emergency services, bullet point number 3 under chapter 6. Next, we have hospice team. A typical hospice team. A typical hospice team includes clergy, physicians and nurses, social workers. Again, clergy meaning pastors, ministers, physicians and nurses, and social workers. Those are your keywords. Okay, we're moving up to the first bullet point. Chapter 6, bullet point number 1, temporary care programs. What are they also known as? They are known as respite care. RESPITE care. RESPITE care. Okay, class, I hope that was helpful. With that, you should be more than able to ace the midterm as well as the final. That is what I meant in class when I said that coming to the review session, attending this, watching this video, you should be more than well prepared to get an A, get a 100% on the midterm. Same goes for your final. Again, I would like to invite all of you, those who live nearby, who can attend, Monday, February 27 from 11 a.m. to 12:15 p.m. in HSBA 3126. The South Georgia Medical Center CEO will be coming to speak to us about leadership and how he got to his position. I hope to see you there and at the midterm.